We spoke to a number of thought leaders who were present at the conference and also people who were speakers presenting. And we found out what were the trends and innovations in UK dentistry at the moment. And we're proud to present this to you in this special broadcast. I'm speaking to Dr. Zaki Kanan, who was, for the second year running, or more than that, presenting in the live theatre and doing a demonstration of how to do tooth whitening. Zaki, can you tell us a little bit about how your presentation went this morning and what you did?
Yeah, I mean, I'm thankful that Dentistry Show asked me again for the second year in a row to do the live theatre and whitening specifically. Apart from being first on stage, a little bit nerve-wracking being first, and you realise that there's things that you don't have to start with, but it went really well, and it's amazing how much interest there is in whitening and how much little people sort of know about it. It's one of those things that a lot of people think it's quite easy to do, but there's still a lot of questions out there that hopefully I've answered for them.
Yeah. So, what were some of the interesting questions that came up?
It's just the controversy about whitening in the UK is still a bit of a grey area with what you can and can't use in terms of percentages, hopefully I was able to answer and reassure people about what the guidelines are and all this sort of thing. And then there's lots of questions about, does the light do anything, and is home whitening better? So there's a lot of questions with whitening, and the good thing in the live theatre is while I'm doing the procedure, I'm able obviously to switch the light on, and I'm able to go around and answer people's questions as we do it. So you've got a whole hour of people just firing questions at me and I'm answering them. So it's a really good sort of setup they've got,
Okay. And would you say the percentage of people who came to watch you, how much of the percentage was dentists and how much were hygienists?
That was the first question I asked actually, and usually with whitening, when I first started lecturing about it, it was around the time when hygienists were allowed to do whitening.
Okay.
I said, how many hygienists listening to the talk? And only a few people put their hands up, and it was mainly dentists there.
Okay.
So dentists traditionally are the ones that just started doing whitening without going on a course, and they're slowly realizing that actually maybe I should go on a course to learn more about it.
Sure.
So it's mainly dentists.
Okay. And what would you say do you enjoy most about presenting in a live theatre format?
Like I said, the nice thing is that, while I'm doing the procedure and talking through it, while we switch the light on, I can answer questions at the same time. So it's quite a good sort of setup like that. It's not just sort of doing a lecture and people are just listening to you.
Yes.
So I like the sort of setup like that.
Interactive in that way.
Yeah.
Okay, fantastic. And if you could give one piece of advice to any of our viewers who are watching this about getting into tooth whitening or getting better at tooth whitening, what would that be?
Obviously there's 3 levels of education. First level is just going to a lecture, so you just hear someone speaking with the slides behind them and just going on that. The second level is doing similar to what we did today, which is sort of a live demo, so lecture and a live demo, so you can see how it's done. The best way really, I think, to sort of learn about it is to go on a hands-on course where you actually do the procedure on each other and practice on each other, because then you know how to put things in the mouth, and you get a feeling of how it feels on you, because a lot of time we do things on people without knowing what it feels like.
Sure.
So I think that's the best way of learning. So
fantastic. Thank you very much, Zach. I am interviewing Dr. Anoop Maini, who was part of the Aesthetic Dentistry presentation program. Dr. Maini, can you tell me a bit about what you presented about at the show?
I presented a technique called 6-month smiles, which is a short-term orthodontic technique designed for general dental practitioners to try and improve smiles in a very realistic manner, in a minimally invasive way of delivering cosmetic dentistry.
Okay. And how was the concept of a 6-month smile received by your audience?
There was a lot of buzz in the room afterwards. We had a lot of positive feedback. We had lots of Q&As afterwards, and my stand, which is at the exhibition, has been overwhelmed. We've had a huge response. So I think dentists these days are so much more conservative in their approaches to dealing with aesthetic cases, And we're now giving them a very powerful tool to approach those smiles very comfortably and very easily.
And what would you say are the best aspects of being in aesthetic dentistry right now in the UK?
Aesthetic dentistry, because there are just so many people out there who just want to improve their smiles, is completely abundant. I mean, wherever I go, there's always someone with a crooked smile. And as a media interest and people get more concerned about the way they look, the demand for cosmetic dentistry is always forever increasing. And it's a great time because it's dentistry which is really valued. People love and praise you for when you can deliver a beautiful case. And to me, that's so rewarding, being able to do a beautiful case and also to give that patient and restore their confidence again. And that's really what drives me every day.
And what aspects of this particular show have you enjoyed the most?
I've loved the live patients theatres. I've watched a couple of procedures. I watched the implants. I think that was fascinating, watching other practitioners, because obviously in your own clinics you're stuck in that one room, and to actually be able to go out in an open forum and watch someone else at work was fascinating. Also, in a show like this, you meet a lot of friends and colleagues, and you can network, you can share ideas, and it's a fantastic little community.